deadly virus appears to be spreading quickly in China.
China says the number of people infected by a mysterious respiratory virus has more than tripled over the weekend.
There's growing concerns about the dangerous coronavirus from China. The number of cases has gone from a few dozen last week to nearly 300 now.
Turn now to the mysterious and deadly virus. Tonight, authorities confirm it is being spread from human to human. It started in China.
There is an alarming development tonight in the outbreak of a new SARS-like respiratory illness, first detected in China.
Okay, thank you very much, Yusek Eric. And once again, in behalf of the DOH, I welcome you to our daily press conferences. And this is the second one, beginning yesterday. And today, the DOH is confirming that a 38-year-old female Chinese patient under investigation, or PUI, is positive for the novel coronavirus 2019-nCoV after her lab results arrived today from the Victorian Infectious Disease Reference Laboratory in Melbourne, Australia. The DOH, however, continues to guarantee the public that all necessary precautionary measures are being taken to halt the spread of the virus. The confirmed case arrived in the Philippines from Wuhan, China, via Hong Kong last January 21, 2020. The patient sought consult and was admitted in one of the country's government hospitals last January 25 after experiencing mild cough. She is currently asymptomatic. So let me repeat. She is currently asymptomatic, which means she has no fever, and no other signs and symptoms suggesting illness at this point. I assure that the public that the DOH is on top of this evolving situation. We were able to detect the first confirmed case because of our strong surveillance system, close coordination with the World Health Organization and other national agencies, and the utilization of DOH's decision tool or the evaluation assessment tool. We are working closely with the hospital where the patient is admitted and have activated the incident command system of the said hospital for appropriate management, specifically on infection control, case management, and containment. We are also implementing measures to protect the health staff providing care to these patients. DOH is also in close coordination with the Interagency Task Force on Emerging Infectious Diseases, or EID, which includes representatives of the Departments of Foreign Affairs, DFA, the DILG, Interior and Local Government, the Department of Justice, the Department of Labor and Employment, the Department of Tourism, the Department of Transportation, as well as the Department of Information and Communications Technology, or DICT. The task force will convene a high-level meeting tomorrow, January 31, 2020, to discuss the first confirmed case and developments arising from these health events. The Bureau of Quarantine remains on high alert and is in constant coordination with authorities from all ports of entry for stricter border surveillance. DOH assures that its health facilities are equipped and prepared to receive and care for PUIs, as well as confirmed 2019 nCoV cases. DOH has recorded a total of 29 PUIs, 18 in Metro Manila, 4 in Central Visayas, 3 in Western Visayas, 1 in Mimaropa, 1 in Eastern Visayas, and 1 in Northern Mindanao, and 1 in Davao. 23 PUIs are currently admitted, and 5 have been discharged, but are still under strict monitoring. DOH also reported 1 PUI mortality yesterday. We did that. Finally, I urge the public to stay calm and remain vigilant at all times. Let us continue to practice good personal hygiene and indeed adopt healthy lifestyles. Thank you.
Okay, we have